So, hi everyone. I'll just go through everything again with you. So, my name is Shazia Khan. The unit that we'll be doing today is called Effective Communication in Health and Social Care. And there's 3 learning outcomes and 1 assignment discussion. So, we've got 1 learning outcome today, 1 tomorrow, and then we've got the assignment discussion and the learning outcome 3 next week. Okay. So, the resources are available on the VLE for you, which is Moodle. Have you all got access to Moodle? Esperance, have you got access to Moodle and Bazi? Yeah?
Yeah.
Yeah. If you get onto Moodle, you can get all the resources, any sort of additional reading, any sort of assignment discussion. They are all available on Moodle for you. So that's the VLE we're using. Okay, so we're going to go into learning outcome 1. So when we look at effective communication within health and social care, we look at the element of why it's so important to have it within health and social care settings. So, people are able to communicate with each other. The first learning outcome is to understand the communication approaches used in health and social care. So there's different elements of different approaches that are used within health and social care. The indicative content, we'll be looking at the reasons for communication in health and social care. We'll be looking at the importance of effective communication in health and social care. So things like, empowerment, exclusion, guidance. We'll be looking at the different types of communication as well. So key terminology, what are the reasons to have effective communication? So why is there need to have it? It's really important to identify any sort of elements of why we need good communication. In health and social care, it's really important because we are addressing issues, individual issues. We're building this rapport and this trust element with the maybe individuals who are getting the treatment, patients. It could be families and carers and any sort of representatives or advocates, colleagues. It's so important to work together with colleagues to identify how we work together. And obviously, if you're working one shift and the other colleagues working another shift, and you come on and you have to have good communication with that colleague just to tell them if you've dealt with a patient, how you've dealt with that patient, and also, other professionals. Why do you think it's Esperance? Why do you think it's so important to have a good communication with other professionals and other care providing services? Why do you think, Esperance, it's so important to work with other hospitals, maybe other social care units or any sort of other agencies of care? Why do you think it's so important to have a good communication?
It helps to provide the perfect and the accurate care to the patients, and the right one as well.
Yeah, because that agency might have worked with that patient that you're working with now. So, it's all about trying to understand, if that patient, they have different needs, they may be, their patient safety, maybe how they've dealt with that patient, any sort of medication or anything they've given that patient. So you need to work with other professionals. Maybe you're sending a patient to an elderly care home and you need to make sure that everything is in place. So you need to work with a person to make sure that you're building this, you're collaborating together, making sure you're building this element of trust, and good communication will build trust, and also good rapport and support between like staff and other support staff to promote this kind of healthy and positive living environment for individuals. So the main reasons why people communicate is to make sure that they share information. It's really important they obtain information. They make sure they share the information between them, because again, when we're talking about patients and things, the different organizations need to know about sharing information and how they can share information about that patient, and what they need to do and how they need to do things. To also express needs and wants and feelings, sharing thoughts and conveying information and expressing that you're happy or you're sad? Why is it so important to express your needs, your wants, and your feelings? Why do you think, Bazizan, why do you think it's so important to express your emotions?
It's to tell,
Sometimes, you know,
yeah,
yeah,
it's to tell them how you're feeling.
yeah,
Sometimes they follow how
yeah.
you're the one knows how you're feeling for
Could you be
yourself.
happy all the time?
No,
Yeah. There may be a feeling of sadness, there may be a feeling of anger, you know, or frustration. You know, you have to, you know, try to build that, you know, rapport between you, make sure that you are able to communicate your feelings across as well, because it's so important, Bazzy, you know, trying to get that um and to like we said, convey information, obtain information, make sure you know that you're able to, if it's anything about a patient, you're able to identify any sort of information that you need to have in regards to that patient. You may need that patient's, you know, details, so make sure you've got the patient's address, information about their medication. It may be just minimal information that you need, but you need to make sure that you're able to identify and express that as well. And also to interact, to give information. It's really important that you not just take information or get information. It's also giving information to people, you know, outside. Communication is the main tool for someone to use to interact with people as well. The next one is interaction with socially. That is the main tool that will help you interact socially with people, collaboration, making sure that, you're sort of like building this trust, but also collaborating with other healthcare professionals, making sure that, you are, it's important to share best practices as well, and, improve the overall quality of care. So interacting socially with others would help you build this rapport as well. So the next one is effective communication in the form of what it is and why it's so important in a person-centered way as well. So like we said, effective communication is a skill that involves being clear, concise, and obviously considerate. It's all about, listening to the individual, making sure that you are effectively listening to that individual. Why is listening skills so important? Why do you think listening skills are important? Esperance, why do you think listening skills are so important?
It's important because you'll be able to understand the patient's
Yeah.
needs.
You're able to understand the patient and what they are saying, and it's not just listening, doesn't just mean understanding the words or the information, but also understanding their emotions as well. And they may be in pain or anything like that, and you're able to understand their emotions. So it's really important you portray that you're understanding what the individual is saying. Then you've got the effective listening skills. So, making sure that you're giving them their full attention as well. If you're talking to someone and you're not focusing on that person, and, you're distracted, that is one of the things that you need to try avoiding when you're, listening to them effectively. You need to avoid any sort of focus on that individual, and avoid any sort of distractions. Make sure you've got good eye contact with that individual as well. That identifies that you are listening. And, understand what they're saying. It's really important to understand what they're saying and respond and reflect on it. Active listening and reflecting, responding and giving feedback isn't always easy to do, but, you need to make sure that you're able to pay attention to the individual. You're able to, withhold any sort of judgment as well, reflect, clarify with them what they're saying, summarize and share. So, it's really, really important that you pay attention. That is one of the main things when it comes to effective listening, to set this comfortable tone between you or maybe the patient, and not allow them time to respond and not cut off as well. So there will be appropriate effective techniques. Also, they will be able to discuss alternatives for informed decisions, and they will also be able to support and communicate with their needs. So people will have different needs within health and social care. Not every patient will be the same, and everyone has different needs, and you have to listen to that person to make sure you are taking on board what their needs are. You know, and why do you think it's so important? Oh, we've got Matilda on as well. Matilda, why do you think it's so important to effectively listen to elderly patients? Why do you think it's so? I mean, it's important to listen to every patient, but why do you think more time and effort is needed for elderly patients? Hi, Matilda, can you hear us? I can't hear anything you're saying.
Hello, please, can you hear me now?
Yeah, I can hear you now, Matilda. Why do you
Okay,
think it's so important to, you know, be more, listen more to elderly patients?
I would say we have to, because they need more attention,
Yeah.
and then you emotionally you are giving them some kind of assurance when you listen to them.
Yeah, yeah. So and sometimes, you know, when it comes to listening to elderly patients, they don't always, you know, they always struggle with what they're saying, or maybe they get confused with what they're saying. So you need to make sure you're listening to them properly. You know, they may be talking about something and then they may switch. So, you know, for elderly patients, it's a big thing as well. Again, you know, there's a video here that you can watch in your own time. So make sure you have a look at that video. And that video looks at effective communication within health and social care. And it looks at the element of importance of effective communication within health and social care at work, and why there's a need to have effective communication. So have a look at that video in your own time, please. So the next one is communication, why it's so important to have communication in place, and why there's an element of, you know, in the health and social care. So effective communication in health and social care is a fundamental element of health and social care, because it, you know, it's able to emphasize when needed, and to talk about potential procedures. You know, anything that is important in health and social care, you know, you need to be able to communicate your skills across to patients. It may be to other workers. It may be to, you know, communicate to what care patients receive as well. That's really important. Examples of health and social care settings where effective communication is necessary is things like, you know, hospitals, GP surgeries, dentists, nursing homes, social care. When, you know, you can communicate with each other and the patients, do you think it's important for patients in regards to making them feel comfortable as well? Because it's so, you know, you are talking to someone and their patients and their family, and the whole point of communicating with them is to make them feel comfortable in their settings, you know, making them feel at ease about what you're talking about, you know. So it's really, really important. Some communication approaches, the first one is a really important one, which is used quite commonly, is verbal communication. So, you know, having verbal communication within health and social care. What is verbal communication? What do you think verbal communication is? Amu? I think
Yes.
someone. What is verbal communication?
To communicate verbally.
Yeah, communicating verbally, okay?
Mm.
Can it be spoken or written?
It can be spoken.
Yeah. So
And
verbal
written are different.
communication is really important within health and social care, because it looks at the element of, you know, actively listening to that person, being able to, you know, identify that person's needs as well. You know, you are actively listening to that person and you're taking on board what they are saying. You know, verbal communication is a foundation of any sort of care delivery, you know, where the practitioners will gather information about patients or clients. It's where you, for example, it may be you explaining to the person about any sort of procedures and treatment that are happening, or offering emotional support as well. That's a really big part of verbal communication. If you're able to offer emotional support to that individual. Why is emotional support so important? Why do you think emotional support is so important? Offering emotional support to someone.
I think it's important because emotionally,
Mm.
emotions also contributes to the healing process.
Yeah. And it could be family, it could be the individual, it could be anyone. So, you know, verbal communications, as Omo said, involves the use of spoken words to convey ideas and emotions. It is common, it's the main common form of communication used in health and social care settings. And staff are trained to use clear and simple language when communicating with people, because some individuals don't understand what you're saying. You know, if you're using long jargon, or if you're using words that medical words, they don't understand that. So you need to make sure you are communicating effectively and making sure that you're communicating in a way that they understand. So it could be a child, it could be an elderly patient, but you are communicating the way they understand. And sometimes, you know, again, active listening is an important part. Open questions, simple yes or no, and paraphrasing things, you know, changing wording for them, making sure they understand, because some patients will struggle to understand certain wording. So if you communicate that properly to them, they'll able to understand it and make sure that, you know, you have got the words across to them. Because if you're talking to a child, are they going to understand everything you say? If you're talking to a young child, will they understand almost everything you say?
Not everything they were
No. Sorry?
No,
Not all children will understand, will they?
no,
And
yes, not everything.
you've got to take their needs into account. You know, people have different
Exactly.
needs. So it's
Exactly.
really important to take them into account. And sometimes we don't, I'll be honest with you, sometimes we don't take them into account, but we should be taking them into account, because that is how that person learns. The next one is non-verbal communication. And non-verbal communication it's a vital part of health and social care. It looks at our attitudes, it looks at our emotions, and it looks at, you know,
Sorry to interrupt. Please,
yeah.
can you make the screen bigger
Yeah,
and very readable?
Yeah. So what I'll do is, I'm sure I can, let's just 1 minute. View it. Let's have a look. Slideshow, maybe slideshow from current slide. Can you see that now? Oh no. Slideshow from current slide. Let me just see if I can get this a bit bigger for you. Is this okay? Matilda, is that okay?
Please.
Yes?
Thank you.
Okay, so let me just 1 minute. Right, okay, so you've got non-verbal communication. That could be things as body language. Why does your body language play a big part in your communication? How does it, body language? What do you think body language involves? Can you hear me? Yeah. Body language, gestures, your facial expression, that plays a big part in it. How you look, you know, your non-verbal cues, your body language. It may be the layout of a room. It may be how how you position your body. It may be your facial expressions.
Attitude.
Facial expressions are really important, because sometimes people don't smile. Certain people don't smile, but it's not because they're not being nice. It's just because of how they are. You know, why do you think your position of your body plays a big role? You know, if you're folding your hands, what does that mean? Are you happy? Are you sad? Are you
Your
upset?
uncle's name?
Yeah. What about touch? When you're touching someone, why do you think that's a big thing? Touching is a powerful tool. Why do you think touching? Do you think touching is a good thing for some people in certain cultures? Touching can
Not
be
at
I
all.
think
And it
you
depends
need
on where you're
attention.
touching as well.
Sorry?
You need attention.
You need it, but do you always need attention? Because some people might get upset. I understand, Matilda, you're right. People do need attention, but some people might get upset if it's a cultural thing. You know, some people don't like touching.
In some cultures, it's not even acceptable.
Yeah, it's not acceptable. I will tell you within certain, in the Muslim culture, a man touching a woman is not acceptable in the way they touch. But in some cultures, you know, it's a way of comforting someone, you know, and reassuring them that everything's going to be okay. Again, eye contact is another one, which is appropriate eye contact when you're engaging with someone. You know, the way you look at them, staring at them, looking away, maybe looking sideways, maybe looking over their shoulder. That's, you know, sometimes it's really important because that's when you, if you're talking to someone, you're listening and engaging with that person. So eye contact is really important. You know, using body language is important. It's a way of reinforcing spoken words to understand how someone feels. You know, a patient who claims to be fine may display some body language indicating the opposite. They may not be fine. You know, so you've got to, you know, sometimes you misread it, but sometimes culture plays a big part in it. You know, like you said, in some cultures, you know, touching someone is not acceptable. You know, body language is not acceptable, but in some cultures, you know, it's okay to make the patient feel, you know, at ease, because like you said, the patient may feel that, you know, they're not, they may be upset, you know, and sometimes they want that kind of softly spoken way, or even, you know, that touch as well sometimes. Then you've got written communication, and that is vital part of any sort of a setting, but more importantly, health and social care setting, because written communication is where we create records and provide instructions and put elements of that together, you know, accurate. It has to, why do you think it has to be accurate, the information, the written communication? Why do you think accuracy is so important? If we're writing something about a patient, why does it have to be accurate?
Because you don't want to make mistakes
Yes.
about the patient's what is it called, documentation.
Yes. Yeah, and
Yeah.
again, when we're talking about care plans, we have to put care plans in place, don't you? And if
Yes.
care plans are wrong, then it's not going to meet the care needs of the individual, are they?
Of the patients, exactly.
Yes, so you have to make sure that you're stringent, and you make sure that, you know, care plans are put in place that meet the requirements of the individual. You know, you need to make sure you avoid any sort of misunderstanding, any sort of, you know, errors. You know, it's one of the things, it's in health and social care, it's really important because and also could it lead to legal obligations as well? Could it, if you don't do anything properly? If you don't comply with written communication, could it be a case for negligence or something?
Yeah, it might be.
Yes.
Yeah, definitely.
Yeah, because it could be that for legal compliance, you're complying with written communication, you're complying with the organization's legal, you know, requirements, the policies, the procedures, you're following them. So written communication is really, really important part of any health and social, any setting actually, but mainly health and social care. Medical records, and that needs to be having the patient's history. Why do you think that needs to be all clear and up to date and, you know, easy for the individual to understand the element of medical records? Why do you think it's important to have medical records up to date and the right medication and things like that? If the patient's moving on to a different hospital or something, is it really important that medical records meet the requirements and they are done properly?
Of course.
Yeah.
Take along the medical records.
Yeah.
Also. It's highly important. So that
Yeah.
because it has all it has all the details of the patient.
Yes, it does, yeah.
Oh,
So you need to make sure all the details are accurate. You need to make sure that everything is up to date.
mhm. And then they can easily read and digest everything about the patient in the on the medical records.
Yeah.
Is it that the doctors, the nurses, anyone?
Yes, Vida, you said it's very important, which is, you're very right. It is so important in regards to that, making sure everything is up to date. Information leaflets, these can be written leaflets about any sort of health conditions, any sort of health treatments, or any sort of care services. Why are information leaflets important? Some people don't read them. Some people think they're really useful. Why do you think they're really useful? For example, if someone's got dementia and you've got a leaflet up there and the patient's family don't know about it, is it important for the family to read that leaflet or understand that leaflet?
Yes.
And what they're expecting as well, Omu, sometimes a family, doesn't know what they're expecting if someone's ill. So
Definitely.
it helps them. Leaflets are really good for them.
They have the
Sorry,
contacts.
what's that?
They have like details of what is it called about the sorry, I'm saying disease.
Yeah, no, it's okay. Yeah. It could be a disease, it could be an illness, it could be cancer, it could be dementia, but they need to know about it, don't they?
About it,
Yeah.
So that with that, at least it can give them like a sort of subtle
Yeah,
to like, oh, this is okay. And
yeah,
people are having it. It's not
Yeah.
as if it's a death sentence,
yeah,
but at least they can easily get help.
yeah. It's really
Whenever,
important. I mean,
whenever-
I remember when I had diabetes and they were telling me I read some leaflets at the surgery because I was so confused about what it was, but this was 7 years ago. But it helps someone, understand, certain concept, what they can eat, what they can't eat, things like that. And I think it's really, really important to have leaflets in place. The next one is technological communication, and that is again the use of any sort of digital tools within any sort of healthcare professionals, healthcare providers, any sort of platforms they facilitate, they communicate with each other. They need to have things like they've got an example here, EHRs, digital version of patients' histories. Now everything is within health and social care and within other settings, everything is becoming more digitalized. So there's no paper notes or anything. Why do you think everything's becoming more digitalized now?
it's okay, it's there because of confidentiality.
Sorry, what's
Then
that, Omo?
because every time in the hospital you see nurses with their phone. On the
Yeah,
phone, they have access to each individual's what is it called, profile.
yeah,
So whereby they will get in and then get exact details of the
yes,
patients,
yeah.
and
And
then
sometimes,
they won't
having
have any
files,
access to mistakes.
they lose the files, don't they? They don't always have,
Oh
yeah.
yes,
Yeah, so
yes.
it's good to have it all online.
Mm.
Telemedicine is a technology to provide any sort of remote healthcare consultations via video referencing, which is working, allowing patients to access it, from globally as well. Text
Yes,
or email for appointments, more of it is becoming more electronic, and sending texts to patients and making sure they attend their appointments and things. The next one is visual communication, which is uses things like, images, charts for certain people to understand. There's people within health and social care, that may need sign language, maybe, a way of conveying what they mean. Also, pictures and symbols, they play a big part of it, communicating in pictures and symbols, people with disabilities, or learning difficulties. And the next one is visual hearing aids, devices that amplify sounds for individuals with hearing impairments. Why is it so important to have all this in place for people? Do you think everyone's the same? Every patient you get or every individual you work with, are they all the same, or do everyone have their own, where they may have learning difficulties, they may have special needs. So they need, so you need to cater for everyone. And communication is really important in that element when it comes to oral or visual communication. So when we look at person-centered communication, and this is a way of communicating with people that takes into account their individual needs, preferences and communication style. It could be used in a variety of settings in health and social care. So you are taking into account things like empathy, you know, making sure that you are sensitive to the feelings of others. You are taking into account their validation, you're accepting their feelings and thoughts of others as well, and allowing service users to make their own choices, you know, making sure that they are able to you are creating this kind of space for them, you know, that they are able to acknowledge themselves. You know, it's so important for person-centered communication to provide a level of empathy. Why do you think empathy is so important? Why do you think when we talk about empathy, it's so important to be empathic with someone, especially if it comes to a patient? Why is it important to understand someone's needs and feelings and how they are feeling? Do we
to know how to support them?
Yeah, how to support them is really important, because that individual may be feeling really down, being really sensitive to what they've been told. And if you know, are validating and accepting their feelings and thoughts, you're building this element of trust with them. And, you know, it's a positive thing for that person, you know, and it makes that person, you know, take responsibility of their own, you know, their own life. And, you know, listening, again, another element of it, allowing the service user to make their own choices. It's really, really important. Communication passport is a guidebook for individuals, a document that provides communication with others who have difficulty speaking for themselves. It can include information about the person's communication strengths and their needs, likes and dislikes. So it could be, you know, for them to identify elements of how that can support them. So it's literally a guidebook for them to identify any sort of information about the patient's care, and any sort of personal details, the type of medication they're taking, any sort of pre-existing conditions, how they express pain, or what they like and not like, you know. So it's really important to have a communication passport in place for individuals. Group communication, again, really important in health and social care, because it's the exchange of information, ideas and feedback between multiple healthcare professionals or care workers within a team setting, aimed at collaborating on patient care decision making, building strong relationships and delivering an efficient and effective service. You know, it's all about listening. Why does when we talk about group communication, what's the whole purpose of group communication? What do you think? Why do you think it's important to have group communication? Omo, why do you think it's good to work in a team and have this group communication between you? But in working in a team, it helps you, you know, communicate ideas, you know, share knowledge. It's really important to share knowledge between each other. And if you're able to share knowledge, you're able to facilitate, you know, and coordinate things with making decisions, informed decisions. But if you're listening and working with others, it helps you, especially other team members, you know, they're able to share information with you, share ideas with you, and if there's any sort of ideas for improvement. So you have therapy groups where people might be able to, with similar conditions, talk about their experiences and stuff. And I think therapy groups are so important for patients, because some patients don't want to talk about what they're going through. Team meetings where people meet together, as we've said, make sure that they, you know, work as a team, make sure that they're able to come up with ideas and any sort of share any sort of perceptions or any sort of areas for improvement. Cultural sensitivity, and this is a big part of health and social care. Why is it important to identify cultural sensitivity. And some things have been mentioned earlier on as well. Why do you think it's important to identify cultural sensitivity and awareness? Why is it important to be aware of that? Esperance, why do you think it's so important to be aware of cultural beliefs, values, religion? Why do you think it's so important to be aware of all that?
I think it helps to create barriers and know
Excellent, yeah.
what and what's not to do as a
Yeah.
help.
Do you think in your job role, Matilda, do you think it's important for you to know about the patients you are helping, or you're with someone? Do you think it's really important to know about their culture and their beliefs and their values?
Yes, I
Yeah.
think it's important for me to know
Yeah.
so that I know what and what's not to do.
Yes.
For instance,
Do you
we're
think
talking about
sometimes
the touching.
if you don't know about that, do you think you can offend people?
Please come again.
If you don't know about certain cultures and values and beliefs, do you think you can upset people and offend people?
Yes, I think you can offend people.
Yeah, yeah. I think it's really important to know about people, not everything. You don't need to know about everything in detail, but small things like, we talked about touching someone. Within Muslim culture, they wouldn't want you to do that. A man would not want you to touch a woman, or that's a barrier they would have in place because of their cultural and ethical, their values and their beliefs. In certain cultures, to shake hands is not acceptable as well.
Acceptable.
So you need to be culturally aware of working with people, from different attitudes, different worlds, that you are accepting of their culture. Amu, what do you think about that? Because I think you had you.
Yes, you're right. That is, you can't. You have to respect people. It's not everything that we know
Yeah,
about culture of an individual.
yeah.
So we
It
have to
needs
respect
to,
people.
and the organization you need to work for needs to promote this, multicultural kind of, culture, and make sure that, you are, working in that kind of environment, because your culture might not be the same as my culture. But you have to accept everyone's cultural belief, the way they dress, the way they wear if they wear a headscarf, if they wear, if they wear gloves or anything. It could be some minor stuff that you have to accept, because you have to make sure that you're culturally aware of them, especially in health and social care, because you get people from all walks of life. Again, confidentiality is another important part of it, ensuring that private information about service users is kept confidential. Why do you think it's so important, confidentiality in health and social care profession?
Because you don't want any people, just anyhow people to know about different, patients and details.
Yeah.
Why they are in the hospitals.
Yes.
Even all the staffs.
Yeah.
Yeah. Anyone could
You are respecting others' views, aren't you? You are respecting
Exactly.
people's views. For example, if there's private information about the person's illness and they don't want anyone to know, then you are protecting their privacy, aren't you? Yeah, and can a breach of any sort of confidentiality can lead to elements of theft, fraud, or damage of reputation. So you need to maintain that. And within the Care Act 2014, it provides guidance on what to do if confidentiality is breached. So you have laws in place that make sure that confidentiality is kept, records are kept safe, and people's private information is kept safe. So you have to follow the laws. It's not just a requirement that is a code of ethic. It's the law that says that, because GDPR and things like the Care Act identify confidentiality as one of the important elements of it. Feedback as well, encouraging service users to provide feedback and using the feedback to improve services. Why do you think feedback is so important? Some people don't like feedback, but I think it's really important in any organization. Why do you think it's so important?
Kind of a recommendation.
Sorry?
I said recommendation.
Yeah.
Yeah.
And also how to improve the services. You know, it's not about you, it's just about how to improve the services and make sure, you know, you are doing something which is, you know, helping the individuals. Effective communication, again, is the bridge that builds the rapport and ensures that you working with patients, it's a way of, you know, you building that rapport, that trust between you and the individual, and it's adaptable for healthcare professionals. Explain the importance of 1.1, the importance of effective communication in healthcare setting. So it's there to promote person-centered care. So effective communication ensures that you are tailoring everything towards the individual's need. Effective communication is really important for ensuring safety, making sure that the client or the patient feels comfortable, you know, making sure that they are safe. Any sort of misunderstanding or lack of medication, like we mentioned earlier, could cause a lot of problems. Builds trust. Builds trust is a really big one. You know, any sort of element of trust is built. You know, you having effective communication requires, you know, building this trust and this rapport with everyone, making sure that you are having an element of trust with them. If someone trusts you, will they tell you everything?
They will. They trust you.
Yes, they will.
Yeah.
And they will, and you have to build that trust. You just don't get it, do you? Just like that. You have to build that trust with that patient or anyone else.
Yes.
You need to build that trust by making sure that they are heard, you know, and you are listening to them and encouraging them to seek any sort of care. Supports decision making, so service users make informed decisions about the care. So effective communications ensure that they understand any sort of potential risks. Any sort of clear communication ensures that it's involved in, you know, informed decisions, providing the need for them, what they need and what benefits are in place for them. Enhancing team collaboration, so working together, again, effective working with your effective team. By actively listening, you work together as a good team. Sometimes if you don't listen and you think you are better than the person, then, you know, the form of collaboration doesn't work between team members. You have to all collaborate together and make sure you are all on the same page. Because, you know, certain people don't like to work together. Yeah, it's very important. Sometimes, you know, you do get that in health and social care where people don't want to work together.
Yeah,
Supports emotional and psychological well-being. You know, it is a stressful job. Make sure you are working together to reduce any sort of anxiety, and make sure you are, you know, making the individual feel they're understood and valued. Promoting health literacy, proper communication is really important. Make sure you are listening, make sure you are able to understand that person, you know, make sure you are able to identify any sort of how they can manage their needs and things like that. You know, that's really important. Make sure that you are listening. Listening is a really big part of you know, elements of that. Again, the next one, respect people's culture, which we've been through, elements of making sure you are respecting their culture. You know, culture is a big part of it, making sure you are listening to them, and everyone's got different cultural views. So making sure that you are, you know, sensitive to their culture and you're able to respect different cultures, backgrounds and beliefs as well. The next one is facilitating informed consent. So before any treatment, you must give informed consent. And this can happen when you have effectively communicated with any sort of risks and benefits and alternatives of that. Reduces conflicts. So if you have clear communication between individuals, what does it mean by reducing conflict? If you have clear and concise communication between individuals, will you have any misunderstandings?
No.
So if you have give clear instructions and you know, it can, you know, make sure that instructions are clear and you've not missed out anything, you know, it reduces the element of any conflicts. You know, you've given appropriate treatment plans and you've explained everything properly without any sort of misunderstanding. It reduces the element of conflict between anyone. Enhances privacy and confidentiality. Again, really important. Confidentiality in any sort of health and social care profession is really important, because you need to make sure that you are keeping everyone's personal information in the right place. It's private and secure, and you are not sharing it with anyone, and you're respecting that individual's privacy and rights of service users. So, you know, it allows you to people to feel safe that the information is not being shared, which is really important in regards to if someone finds out that they've got cancer or any other form of disease or illness. They don't want you sharing that information with their family. If they don't want to share it with their family or anyone, you have to respect their privacy. And it is also, if you enhance privacy, it prevents any sort of misuse of confidential information, and it protects the reputation of the health and social care professionals. You know, you need to make sure you are respecting the privacy of them and their wishes as well. You know, you need to make sure not everybody wants to tell their family members what illnesses they're going through or anything. They don't all want to take that. You know, they feel like they may have to, you know, they don't all want their family to know about their illnesses. It's really important you respect that. I don't, you know, sometimes, you know, you have people that want you to tell their spouse or, you know, their family, but some people don't.
Yes, yeah,
And
right.
should you respect that?
Of course, some
Yeah.
even have a code.
Yeah,
Some even have a code to, if you want to pass information, or
yeah,
like somebody calls
yeah,
and then they want information about the patient.
yeah,
So sometimes you ask for the code. If they don't
Yeah.
have the code, definitely we're not going to give out any information to them.
yeah,
So you have to respect that at all times.
yeah.
Even if the patient is aged 18, 19,
Yes.
you have to respect that.
Yeah, yeah. Thank you, Vida. You're right. It's so important in elements of, you know, privacy. And I think that for me, I think that's the most important thing when it comes to health and social care professional, that you respect the privacy of that individual. Because sometimes you get upset, don't you? And you sit in that
Of
situation
course.
thinking, oh, I should tell the family, I should tell the
Yeah,
husband, I should
yeah.
tell the children. And you as a human being have feelings as well. But you
Exactly.
have boundaries in place, and you've got to follow policies in place that you have to respect. It's what they want. It is very hard. I will say that it's very hard in that situation. But as someone who, you know, works in that profession, your way of building that trust is that you don't, you know, talk about any sort of if they don't want you to share anything. It's hard. It's very hard.
It is.
It's very hard, especially if you've got a parent with a child who's going to die.
Exactly. You're
You know,
right.
it's very hard. But then at that time you have a child, if they're over the age of 16 or 18, then it's difficult. But if they're under, then you can obviously communicate with the parents. But if it's a child over that age, it's very, very difficult because they're
It's very
independent then.
difficult. They don't want to sue you.
Yeah, yeah. Supports continuity of care. So when you have communication in place, there's a need to hand over. You know, you have shifts, don't you, in place, and if you don't have good communication and you're handing over to the next person who's got the next shift, you know, if you don't have good communication in place, you're not going to continue to provide that good treatment, are you?
Yes,
So
no.
if you're doing a handover, you need to have effective communication with the person that you're handing over to.
Yes.
Because you need to make sure there's clear communication between you and any other healthcare profession to ensure that, you know, what medication you've given to that person, ensure that the care that you're providing is appropriate.
Yes.
You can't just say, I've got, for example, you're handing over to Esperance, and you say, here, Esperance, just have the file. You can't do that.
You can't do that.
No, you've got to sit down and talk about it and make sure that you understand and there's no misunderstanding or errors, so that the person understands what you've given the patient, what you've gone through with the patient, and what the details they need so that they're okay for the next session.
Of course, it even helps.
Yeah.
So that you can know you know how you can continue with the patient
Yeah,
treatment
yeah,
and
yeah.
handling the patient in your own shift.
Yeah, and you
So
need to
that,
make you need to make that patient feel comfortable, don't you, Omo? Because
of course,
if
of course.
someone's coming in and they don't understand, then it's a bit of a difficulty in that situation, because they're going to think, oh my God, they've given me to someone who doesn't even understand what they're doing.
Yes, you're right.
So that communication is a huge part of health and social care. Being able to communicate, make decisions, being able to, have this engagement between team members, and, poor communication can result and impact on the well-being of the patient.
Yes.
So in summary, effective communication is, like we said, the cornerstone of health and social care settings. It's about the safety of the patient. It's about trust, decision-making, emotional well-being, and it can't be compromised, okay? It needs to, because if you make any errors and there's elements of poor communication, misunderstanding, or it impacts on the patients, it impacts on your, it impacts on you as an individual. You might have stress and anxiety. You need to make sure that you have the correct information in the place, and it's clear, and you are actively listening and working together to create this safe environment for the individual. So we finished learning outcome 1 now. These are some of the references we've used for today's session that you can link on, and it will help you as well towards your assignment as well, which I'll go through in the assignment discussion. Some plenary, there's ebooks and journals are available on Moodle for you. So if you need to get onto Moodle, the ebooks and everything is available for you on Moodle, so that you can have a read of that. There's 2 links there: communicating with people with learning disability, and 3 must-have communication skills. And them are documents that you could read around elements of effective communication. Okay. Has anyone, just a quick recap of what we've done in today's session. So we've looked at understanding the communication approaches used in health and social care. We've looked at the reasons for communication, why it's so important, why people communicate, so to obtain information, to give information. We've also looked at effective listening techniques, why it's so important. We've looked at effective communication. We've looked at verbal communication, non-verbal communication, written communication, teleological communication, and visual communication. We also looked at the element of person-centered communication in regards to empathy, validation, and choice. We looked at cultural sensitivity, which is really important in any sort of element of trying to remove them barriers. We also looked at the importance of effective communication in health and social care, ensuring safety, promoting safety, building trust, promoting cultural differences, supporting continuity, reduces any conflicts. So we've looked at elements of that in learning outcome 1 to identify how to effective communication is so important within the health and social care setting. Do you have any questions before we finish this session off? Anyone? Any questions? Vida, I know you're in the chat, but have you got any questions? Let's have a look, Vida, in your chat. Yes, that's good. No, please. Thank you, Vida. Anyone else got any questions before we finish this session? Okay, so if you have any questions, or Esperance, any questions, or Omu?
No, thank you.
Thank you.
Thank you. No, thank you. I'm fine. Thank you.
Thank you, Omu. Lovely to meet all of you. And if you have any questions or any queries or anything, email learnerwork@ukvarsity.co.uk. And the next session is tomorrow. So I will see you in the next session, which is Learning Outcome 2. And in Learning Outcome 2, we will be looking at elements of understanding the communication needs and preferences of individuals. So we'll be looking at that tomorrow. So if you have any questions, again, email learnerwork@ukvarsity.co.uk. Thank you for attending today's session, and I will see you in tomorrow's session.
Are you going to send the link as well, please, tomorrow?
Yeah, I can send it. Have you not got the link?
No. Kindly send the link.
Have you got a chat group? I'll send the link.
On the nursing chat.
Yeah, I'll try and send the link what I've got, okay?
Yes, that's fine.
Okay, almost. Nice to see you all. Take care. Bye.
Thank you. Bye.
Bye.
Bye, everyone. Have a
Bye,
lovely week.
everyone.